Today in Austin and across our nation, we honor the brave servicemen and women who proudly served our country. Today I'm honored to stand with this fine group of Texas veterans who continue 2% of our nation's population. However, in Texas, our patients are being left behind and denied that freedom. During campaign season, conservative candidates stand for less government interference in healthcare. Like us, they stand for the restoration of the doctor-patient relationship and getting government out of the way when it comes to medical freedom. Last summer, with the passage of the Compassionate Use Act, the Texas legislature and Governor Abbott acknowledged that cannabis is in fact medicine, allowing it for those with intractable epilepsy. And while we commend them for taking this compassionate step, it is unprecedented that it's unfortunate and unprecedented that lawmakers are making decisions rather than doctors when it comes to the patients that have access to this medicine and the dosages at which they can use it. I am sad to say that our patients are being left behind in Texas, and this includes our Texas veterans, many of whom are suffering from service-related injuries and medical conditions like post-traumatic stress, traumatic brain injury, and chronic pain, conditions that we know that can be benefited from the use of medical cannabis and help to eliminate or reduce the use of dangerous and addictive psychotropics and opiate-based drugs. Polls show that 76% of Texans favor medicinal access to cannabis. And over the summer, the Republican Party of Texas officially endorsed access to medical cannabis with their platform, standing and asking the Texas legislature, calling on them to improve the compassionate use program to make it more inclusive. Last Veterans Day at this very location, we launched a veterans-driven campaign called Operation Trapped. To discuss this campaign, it is my honor to introduce Major David Bass, a retired U.S. Army officer and a veteran of the Iraq and Afghanistan wars.
Thank you, Heather. I retired from the Army in 2006. I'm a veteran of Desert Storm and Operation Iraqi Freedom. And when I retired, I served on active duty for 21 years. And when I retired, I was declared 60% disabled, 30% for PTSD and 30% for chronic pain. And I was prescribed hydrocodone for my chronic pain and various psychotropic drugs for my PTSD. And they had absolutely terrible side to this pain medication. And then some friends of mine introduced me to cannabis, and I did some research on the internet and found out about medical cannabis. And over a period of several years, I found that by using cannabis, I was using less pain medications and didn't feel so much the need for the psychotropic medications. And so over a period of years, I stopped using the hydrocodone completely and stopped using the psychotropic drugs. So for me, cannabis was an exit drug from addiction to pain pills and dependence on psychotropic drugs. My friend, Malachi Muncie, created this artwork here called Trapped. Malachi is a veteran of the Texas National Guard, and Malachi deployed to Iraq twice. And Malachi had the exact same experience as I had with cannabis and pharmaceutical drugs. And so Malachi gifted me this artwork, and several veterans over a period of months were discussing what we could do to convince our legislators and Governor Abbott that we want a medical marijuana program in the state of Texas. We don't want to be criminals. We don't feel like criminals. We don't live our life like criminals, and we should not be treated like criminals in our own state for choosing a safe, effective medication. And so this group of veterans, we came up with this idea for Operation Trap. And so each one of these pill bottles represents a Texas veteran who wants Governor Abbott and our legislators to establish a medical marijuana program in our state. And if you opened up all these bottles, you would find veterans from every single conflict all the way back to the Korean War who have given us these pill bottles. And so what I have learned is veterans going all the way back to the Korean War have been passing along the knowledge of medical cannabis from one generation of veterans to the next. And so I'm very happy that I found out about it, because now I lead a completely normal, productive life in my community thanks to cannabis. So these veterans up here today represent thousands of veterans, and we know this because we've talked to them all over the state of Texas and we're in contact with them. We have a letter for Governor Abbott, and we have over 1,000 Texas veteran signatures that co-signed this letter with me, and we're asking Governor Abbott to meet with a committee of our veterans and let us tell Governor Abbott why we use cannabis in the state of Texas, even though it's illegal. So we're asking, please, Governor Abbott, meet with us. That's all we have.
And that shouldn't be too much to ask for now, is it?
I would like to introduce to you Dr. Scott Beer, an Army veteran, trained at Darnell Army Medical Center at Fort Hood, where I still receive my care. In emergency medicine, Dr. Beer currently works in the emergency department of a suburban trauma center outside of Houston. Dr. Beer is a veteran who was deployed twice, once to Iraq and once to Kuwait. During that time, he served as a flight surgeon. Thank you, Dr. Beer, for your service.
So, as David mentioned, I'm a practicing emergency physician and a veteran of Operation Iraqi Freedom, and I'd like to talk to you a little bit today about my feelings about medical cannabis. I became interested in medical cannabis approximately 2 years ago for several reasons. First of all, while I was lucky I deployed twice and I didn't come back with any major medical issues or chronic pain or PTSD, I certainly have a lot of friends and family that did. Additionally, I also am interested in medical cannabis because of being an emergency medicine doctor as it relates to the opiate epidemic in this country. Being an emergency medicine physician, I'm on the front lines of this war every day. Not a shift goes by where I don't see some ravage of this epidemic, whether it's an overdose or addiction or even worse, diversion. It's a very personal issue to me. So I think it's important when we're talking about medical cannabis that we should talk about the safety profile of medical cannabis as it compares to opiates. So on the one hand, for opiates, we have 50 people in this country die every day from opiate overdoses. On the other hand, we have medical cannabis. 0. Never happened. There's not ever been a documented case of a death from an overdose, surely from cannabis. I read a statistic once that said if you ate 30% of your body weight, you could potentially overdose. So virtually impossible to attain very safe medicine. As far as emergency medicine visits, something again near and dear to my heart, 5,000 per day related to opiates in this country. As far as cannabis, I did read a study that said in Denver, since Colorado has legalized adult recreational use, that the pediatric population has actually doubled for accidental ingestions from around 10 to 20. So we have 20 for a year, 5,000 per day. When you talk about cost, there's really no comparison. Opiates in this country, every year, the bill is $50 billion with a B dollars for opiates. On the other hand, cannabis, several studies have come out within the last year that show that cannabis has decreased the amount of opiate overdose deaths, has decreased the amount of opiate use, and decreased the amount of medicine in general in states that have legal cannabis programs. So obviously a big difference there as well. I think also it's important when discussing medical cannabis, just really quickly, not to bore you, but to touch on the endocannabinoid system. So this is a very robust system of receptors that you have all throughout your body. They're mostly grouped in the nervous system as well as the immune system. I'm going to tell you, despite the fact that you have these receptors on almost every cell in your body, I never learned anything about them in medical school. It's only after medical school that I've learned about that, and I would doubt they're teaching it even to this day in medical school. So it's thought that this receptor system creates homeostasis in the body. This is done through several different mechanisms. So to give you an example, if I put my hand on a hot stove, the stove is hot, my nervous system says, take your hand away. You're going to get hurt. That's adaptive. It keeps you from getting injured. However, if I still have that pain 3 years from now, that's no longer adaptive. So it's thought that the endocannabinoid system can help put that system back into balance, amongst other mechanisms that it works, either through molecules that are cannabinoid-like already in your body, or using it from the plant, the way that we've been discussing here today. So a lot of people tell me that the data is just not there yet. There's not enough studies. We can't trust it at this point. And I'm here to tell you that's absolutely false. There are several indications where it's absolutely been studied. There are not just anecdotal evidence, but there's also animal studies. There's clinical prospective studies done here in the United States and abroad that shows that this is absolutely a safe and effective medicine for several different indications that we're not currently using it here for in Texas. So before I wrap up, I just want to say how happy I was on election night that we're adding several new states to the rolls of the medical cannabis. And I would hope here in Texas that we would follow. Let's try to remove some of the roadblocks. Let's improve upon the laws that we have right now and expand them to other indications, so our veterans as well as all the other patients throughout Texas don't have to suffer. And as a physician, I would say let's remove the government from the conversation between a physician and their patients.